adventure starts with the right gear, and it all starts at shackshop.us. From stylish women's swimsuits and premium camping tents to paddleboards, underwater drones, and dependable dinghies, we have everything you need for your next outdoor adventure. Whether you're exploring the water or relaxing on shore, gear up with quality products at unbeatable prices. Visit shackshop.us today and make every adventure.
DR Congo river boat under quarantine as Ebola fears rise after 5 deaths aboard 255-passenger vessel. The Democratic Republic of Congo has launched an emergency public health operation after a passenger boat traveling along the Congo River was placed under quarantine amid fears of Ebola and cholera following the deaths of 5 people during the voyage. The vessel, identified as the Yingfeng 2, was intercepted just 65 kilometers 40 miles upstream from Kinshasa before it could reach the country's densely populated capital of nearly 18 million residents. Health officials quickly boarded the boat, transforming it into a floating disease investigation as hundreds of passengers underwent emergency medical screening. Authorities stressed that no Ebola cases have yet been confirmed among the passengers, but the incident highlights the enormous challenge of controlling infectious diseases in one of Africa's largest nations, where rivers serve as major transportation corridors linking remote communities with sprawling urban centers. A journey that sparked alarm. The Yingfeng 2 began its journey in Mongala province in northwestern Democratic Republic of Congo, navigating more than 1,700 kilometers downstream toward Kinshasa. Along the way, tragedy struck. Health officials say one passenger developed fever and diarrhea while aboard the vessel. The individual eventually left the boat in the Pimu health zone to seek treatment at a hospital, but later died. Soon afterward, 4 more deaths were reported. Those fatalities included 2 adults, a 3-year-old child, and a newborn baby. Although the exact causes of death have not yet been confirmed, the combination of symptoms immediately triggered concerns because the Democratic Republic of Congo is already battling one of the world's worst Ebola outbreaks. Officials feared the possibility that infected passengers may have unknowingly carried the virus hundreds of miles toward the nation's capital. Emergency response. Once the vessel approached Kinshasa, authorities acted swiftly. Rather than allowing passengers to disembark, security forces intercepted the boat near Bend port and ordered it into quarantine offshore. Medical teams from the Ministry of Health and the World Health Organization who boarded the vessel wearing protective equipment. A temporary mobile laboratory was established directly on the boat, allowing scientists to begin testing passengers without transporting them into the city. Every one of the 255 passengers is now undergoing screening for both Ebola and cholera. The quarantine follows international public health protocols designed to stop potentially infected travelers from introducing dangerous diseases into large population centers. No positive tests so far. Health Minister Roger Kamba attempted to reassure the public by explaining that initial testing has not identified any Ebola infections among passengers. According to the minister, officials believe the risk may ultimately prove low. He noted that the boat departed from Mongala province approximately 22 days earlier, a region where no Ebola cases have officially been detected. Earlier reports had suggested the vessel may have originated from an outbreak zone, but authorities later clarified that was incorrect. Because Ebola has an incubation period that can extend up to 21 days, officials believe most infections would likely have become apparent during the lengthy river journey. If no additional illnesses emerge after that period, health experts say the probability of Ebola spreading from the boat decreases significantly. Nevertheless, authorities are refusing to take chances. Why Ebola is so dangerous? Ebola is one of the world's deadliest viral diseases. It spreads through direct contact with bodily fluids from infected individuals or contaminated materials. Unlike airborne illnesses such as influenza or COVID-19, Ebola generally requires close physical contact for transmission. Symptoms often begin suddenly and may include high fever, severe weakness, muscle pain, headaches, vomiting, diarrhea, internal and external bleeding. In severe cases, without supportive treatment, mortality rates can be extremely high depending on the strain involved. Early detection and isolation remain the most effective methods for limiting outbreaks. The rare Bundibugyo strain, the current outbreak gripping Congo, is caused by the Bundibugyo strain of Ebola. This version of the virus is relatively uncommon. Unlike the better-known Zaire strain, Bundibugyo has appeared only a handful of times since it was first identified in Uganda in 2007. One of the biggest challenges facing health officials is the absence of approved vaccines specifically targeting Bundibugyo Ebola. Several vaccines exist for the Zaire strain, but scientists have yet to develop one widely available for Bundibugyo. Researchers in the United Kingdom are currently conducting the first human clinical trials of an experimental vaccine designed specifically for this strain. Until an effective vaccine becomes available, public health officials must rely primarily on contact tracing, isolation, community education, safe burial practices, intensive medical monitoring. Congo's 17th Ebola outbreak. The Democratic Republic of Congo has experienced repeated Ebola epidemics over the past several decades. Its current outbreak was officially declared on May 15. Since then, the disease has spread across multiple provinces despite aggressive containment efforts. Government statistics now paint a sobering picture. Officials report 3,973 confirmed Ebola cases, 1,801 deaths, 776 recoveries, more than 17,000 monitored contacts, 674 patients currently isolated or receiving treatment. Those figures make the current crisis the country's second deadliest Ebola outbreak on record. Health experts continue to express concern that ongoing transmission in remote communities could eventually reach larger cities if surveillance weakens. Kinshasa on high alert. The possibility that Ebola could enter Kinshasa is especially concerning. With nearly 18 million residents, Kinshasa ranks among Africa's largest metropolitan areas. Its crowded neighborhoods, heavy traffic, busy river ports, and extensive transportation links create conditions where infectious diseases can spread rapidly if not identified quickly. Officials have already strengthened surveillance at Maluku, one of Kinshasa's major entry points from the Congo River. Rapid response teams remain on standby. Hospitals have reviewed emergency procedures. Isolation facilities are prepared should suspected cases appear. Authorities emphasize these actions are precautionary rather than evidence of confirmed transmission. Rivers as lifelines and risks. The Congo River serves as one of Africa's most important transportation networks. Many communities depend almost entirely on boats for travel, trade, food delivery, and medical access. Passenger vessels often spend weeks traveling enormous distances while stopping at numerous villages along the route. That reality presents unique public health challenges. An infected traveler can unknowingly visit multiple communities before becoming seriously ill. Health officials therefore rely heavily on screening river passengers during outbreaks. The Yingfeng 2 incident demonstrates just how complicated disease control becomes when transportation routes stretch across thousands of kilometers. Cholera also being investigated. While Ebola has drawn the greatest attention, authorities are simultaneously testing passengers for cholera. Cholera remains common in parts of Central Africa, where access to clean drinking water and sanitation is limited. Symptoms such as severe diarrhea can resemble those seen in several infectious diseases, making laboratory testing essential. Rapid identification allows doctors to begin treatment immediately while preventing additional transmission. International support. The World Health Organization has worked alongside Congolese health officials throughout the outbreak, whose specialists continue supporting laboratory testing, disease surveillance, contact tracing, training healthcare workers, community education, campaigns, logistics for medical supplies. International organizations have repeatedly warned that continued funding remains essential as outbreaks become increasingly difficult to contain in conflict-affected regions. Hope through vigilance. Although the deaths aboard the Yingfeng 2 have understandably raised concern, health authorities continue urging the public not to panic. The fact that no passengers have tested positive so far offers cautious optimism. Still, officials stress that quarantine measures exist precisely to ensure dangerous viruses do not gain a foothold in major population centers. Every passenger will continue to be monitored while laboratory testing proceeds. Should all tests remain negative and no additional illnesses emerge after the incubation period, the vessel may eventually be cleared. Until then, the Yingfeng 2 remains a stark reminder of how quickly public health officials must respond whenever deadly infectious diseases threaten to cross into densely populated cities. As Congo continues battling one of the world's most severe Ebola outbreaks, every intercepted traveler, every laboratory test, and every quarantine operation plays a vital role in preventing an even larger humanitarian crisis.